Hello, world. Today we'll be discussing in this podcast regarding male infertility. June is a male health awareness month to celebrate and to contribute to the spirit of men's health. We will be discussing about male infertility. Day to day, we don't pay much attention to it, but it is estimated that about 8 to 10% of couples struggle sometime during their life with male infertility. In this podcast, we'll be discussing what is male infertility, what are the causes, how the sperm is made, what's this journey through male genitalia and then to female genitalia, and what are the factors which affects all these aspects of male fertility. And then we will tie up in the end with commonly asked questions, treatment options. It will be a comprehensive guide to help you. My name is Dr. Kundlas, and I've been a primary care physician for 25 years. Male infertility. As I said, male infertility is not an uncommon problem, and a lot of young couples struggle with that. It is defined or it is understood that once male and a female meet and they are planning to start their family, and once they have difficulty in achieving conception and your female partner is tested and there is no medical reason or explanation on the part of female, we are left with our male partners leading to inability to conceive. That is the concept about male infertility. With this background, let's understand the journey. First of all, in a male body, there are three endocrine organ systems which are involved in production of sperm. The hypothalamus is the master control which produces a hormone which we call GnRH. Name is not important, but we need to understand the hypothalamus is one control from where this whole process starts. From there, GnRH goes to pituitary gland and it leads to production of a hormone, and that hormone goes to your testicles. In your testicles, there are two kinds of cells, and your pituitary gland produces two kinds of hormones. These hormone names are common both in males and females. Those hormones coming out of pituitary gland is FSH and LH. And there are two kinds of cells in male testicle, which is called Sertoli cells and Leydig cells. Sertoli cells are directly affected by FSH, and under the effect of SHS, Sertoli cells is the germ cell which produces luteinizing hormone or LH coming from the pituitary gland. It works on the Leydig cell and leads to the production of male hormone, which we all know, testosterone. So you see the master control starting from hypothalamus, then GnRH from the hypothalamus going to pituitary gland, producing two hormones, FSH and LH, and that going back to testicles, which has two different kind of cells producing testosterone and sperm. Now, as you could very well understand, testosterone is not involved in sperm production. There is a loop between the pituitary gland and your testicles. When your Leydig cells produce testosterone, your pituitary gland senses that level and starts shut down the production of FSH and LH. If you are taking testosterone from outside, and it will shut down the production of the hormones coming from pituitary gland, and your testicles will not produce sperms. When the sperm is made in the Sertoli cells, it is moved down to the epidermis. It's a tubes-like structure which is on the upper and the back of your testicles, and you could feel like a rubbery thing above and behind. That's where the sperms are stored. Under the effect of testosterone, During sexual intercourse, from the epidermis, it goes to ejaculatory duct, which opens in your urethra, and then other glands, your seminiferous tubules and other mucus secretion glands, which are in your urethra. They add all the secretions, and the combination of all of them is called semen, and that is gets ejaculated in female genital tract. Journey of sperm in female genital tract is guided from vagina to cervix, uterus, going up in fallopian tubes, and then meeting the egg and fertilization. There is a endocannabinoid system, which is like we know endocannabinoid system in context to marijuana. Marijuana is where it acts in the body, that is the endocannabinoid system. The endocannabinoid system is present in multiple cells, but in context to your fertility, there are receptors in the female genital tract, and there is a gradient. In the vagina and cervix, the gradient is high, and as you go up from uterus to fallopian tubes, the gradient of this endocannabinoid receptor decrease. So this is like a pathway on a runway which is guiding the sperm into the female genital tract. When egg and the sperm meet, the fertilization happens, and that's where the major magic of nature starts. The key components are: number one, your hypothalamus, the master control with GnRH. If your GnRH gets affected with anything, and hypothalamus controls your internal environment, which we call homeostasis. Anything which disturbs this homeostasis, whether it's physically, psychologically, cognitively, that affects your hypothalamus, and you could have a problem. Second target site is your pituitary gland. In the pituitary gland, there are two hormones. If anything which affects the pituitary gland leads to decreased production of FSH and LH, that can lead to problem downstream. Next comes the testicles. In the testicles, there are two cells, Leydig cell and Sertoli cell. Leydig cell are the one which are producing testosterone, and the Sertoli cells are the one which are producing the sperm. Feedback loop which goes back to pituitary gland, and that is mutually inhibiting each other. If one goes down, the other goes up. If one goes up, the other goes down. So the cycle keeps on going. This is the hormonal component of male infertility. Let's look at the structural component. If there is a problem with the Sertoli cells, if there is a problem with the epididymis, if there is a problem with the ejaculatory duct, then all other glands which are contributing to semen production, and then urethra, and then female genital tract. If anywhere there is a mechanical problem, we could have difficulty with fertility. Body is a part of whole system. Any kind of systemic illness can affect this whole process. We could start from top to bottom so that we are building a kind of a theme which will help us to understand if there is any kind of genetic or chromosomal disorders in the Sertoli cells will also lead to problems with the male fertility. Start with hypothalamus, the master control. Any kind of systemic disease, namely diabetes, high blood pressure, high cholesterol, your smoking, your stress, your dementia, cognitive problems, they all change your internal environment, which gets sensed by the hypothalamus and leads to suppression of the hormone GnRH. If that goes down, your pituitary gets down-regulated. Systemic illnesses are very, very important, and they are contributing to a lot, especially the chronic diseases. If you look at it in our society, what are the main chronic problems? Diabetes, chronic smoking, heart attack, stroke, thyroid problems, then systemic inflammatory, chronic inflammatory problems like lupus, rheumatoid, they all can contribute to male infertility. If there is any kind of a problem in the pituitary gland which will lead to male infertility, most common offenders are tumor or sometimes infections like meningitis, viral or bacterial. They all can lead to problems of production of these hormones and can lead to problem. Coming down to the testicles, let's start with, as I mentioned, there are two kind of cells. Sertoli cells or the Leydig cells. In Sertoli cells, if there is any kind of a chromosomal disorder, and the most common chromosomal disorders, Klinefelter syndrome, there are genetic conditions like cystic fibrosis. If there is any problem with the epididymis, if you have any kind of inflammation, infection, tumor, it will lead to problem with the epididymis. Sperm will not be able to store and mature. Moving down the line, if you have a prostate cancer, or you have prostatic infections, or you have primary testicular tumor, they all will lead male infertility. Then let's move on to the urethra. If there is a problem in the conduction of the semen from urethra to the female genital tract, that will also lead to male infertility. Then, if there is a problem with the runway, which is lined by endocannabinoid system, if that gets hijacked, most common in our society, especially since marijuana has been approved in all states, people are using marijuana more and more. That is leading to a lot of male infertility and the female infertility. We have created a video on this topic. You could check it on our channel, Kundlas MD. It is a very complicated process. Both hormonal and physical factors can lead to male infertility. What are the lifestyles which contribute to that? You see, how we live day to day life, that contributes to our risk factor for possible problems, whether we are going to develop diabetes, high cholesterol, if we are a smoker. Coming back to our lifestyle, what are the things which are proven so that we don't develop this chronic medical problem? We start with 5 domains of our life, or 5 domains each human being has. Number one is your body. Your body needs proper nutrition, which is complex carbohydrates, quality fats, quality protein, vitamins, minerals, and proper hydration. It also needs proper rest, managing your stress and sleep. And it also needs entertainment and stimulation. Next domain of life is your emotional. If you are stressed out all the time, it will affect your internal environment, which will affect hypothalamus, and you increase your risk of developing infertility. Cognitively, if you're not growing, you don't understand, then you will continue to repeat the wrong behaviors. Social. We don't tend to give too much credence to our social environment, but our social environment is made up of 5 things. You have other people, places, things, event, and time. So we are going through the river of life, and we encounter in our social environment other people, places, things, time, and event. We are exposed to awfully high doses of toxins. If we develop chronic medical problems, we have to take medications, and those medications, they will do exactly what we want them to do, but they will do some other things in life. So it is a complex cascade. If we clean our lifestyle, then we stand a chance that we will be able to take care of ourselves. Ironically, our testicles are developing in the abdomen. And as we growing up in our mother's womb, these testicles move from abdomen and they are brought to the scrotal sac. And why they are brought to scrotal sac? Lower the temperature. For proper functioning of the testicles, you need less than body temperature to work. Sometimes, if the testicles do not descend all the way in the scrotum, that leads to undescended testes, and that can lead to improper functioning of the testicular cells and leading to male infertility. Our testicles develop in the abdomen, they bring with them the artery, vein, and nerve comes from the abdomen. When they're coming, sometimes those veins become very big, and when your channels or the veins are big, they dissipate a lot of heat that leads to faulty spermatogenesis or production of the sperm, and they can lead to infertility, and we call that one varicocele. There are few tumors. I think we could tie it up now beautifully, the different aspects of male infertility. Those are hypothalamic disorders, your pituitary problems, testicles, then the conducting system. All these things are controlled or affected by your daily habits, which I went over just now. So now let's start answering all the important questions which we have compiled about male infertility. So what is male infertility? Male infertility is when there is problem either with the sperm production, or there is a problem with conducting or taking the sperm from male testicle to female genitalia, or there is a problem in the female genitalia. In this talk, we are discussing everything which is pertaining to male. If the male and the female cannot conceive, and the problem lies in the male arm of this process, that is male infertility. We are asked many times is, how do we diagnose male infertility? If male and female have unprotected sex, there is but 21% in younger age group that the pregnancy will happen. And about 85% of the time, if you have unprotected sex for a year, you can expect the pregnancy. If there is a problem in achieving pregnancy, that's how we diagnose having a male infertility. What are the diagnostic criteria? The diagnostic criteria are that you're trying to start family life and you cannot do that, and your female partner is checked and well. Now, according to AUA, the American Urology Association, they have come up with best practices or guidelines. Their recommendations are, when there is a problem, both male and female should be examined at the same time. Even though we are focusing on the male part of this infertility problem, but they recommend both needs to be evaluated at the same time. During history and physical examination, you are tailoring your question to know if there is a hypothalamic problem, if it's a pituitary problem, if there is a testicular problem or a conducting system problem. We go through this whole process. What are the tests we could do? We like to start with semen analysis. Two samples which are tested separately. We test the semen for volume, sperm count, sperm motility, and chromosomal studies. This will give you kind of a snapshot that if there is a problem of production of sperm, and if all these tests turn out to be normal, then your focus shifts to the conducting system. Unfortunately, there is no symptoms per se from male infertility, but we must know if a couple cannot achieve pregnancy and there's a problem on the male side, it is a very well documented observation and fact they are at high risk to develop testicular cancer. It is a kind of a warning sign too, so do not ignore it. It not only needs to be treated, but you will be possibly at high risk to develop testicular cancer and you must follow it up. If, in addition to sperm production, if you are running low testosterone level, you are at high risk to develop complications from testosterone deficiency. We have lot of educational videos regarding testosterone on our channel Kundlas MD. What are the lifestyle changes which needs to be done in order to improve your chances of fertility? We went through the journey that each human being has 5 domains: physical, emotional, cognitive, spiritual, and the social. This means you at 4 levels, you yourself interacting with yourself, and through the social environment, you're interacting with the outside world. Your food needs to be clean, complex carbohydrates, quality proteins, quality fats, vitamins, mineral, and water. You must rest. Sleep 7 to 9 hours. Your body need exercise. You must aim to have minimum of 30 minutes per day, preferably more than that if you could do that, 5 days a week and preferably 7 days a week. Then comes to emotions. Manage your stress level. Keep yourself stimulated by learning new things, doing new things. You may have some issues going forward, so you must continue to challenge yourself and learn. Keeping this background in mind, now let's come up with a lifestyle. Eat good, exercise, sleep, manage your stress, read, write, learn new skills, and then manage your outside world. Make sure you are not exposed to too many toxins. Ensure you are taking care of your environment very responsibly. What are the medical conditions which could affect male fertility? Any kind of systemic disease. Those are diabetes, thyroid problems, high blood pressure, cholesterol, smoking, anxiety, depression, and autoimmune diseases. What is the role of environment? Our nutrition, our water, our medications come from outside. If our environment is not clean and we are having a lot of toxins, that will directly affect your fertility. Make sure go organic as much you can. Most important question which is asked over and over, we have been discussing all different reasons, but the number one reason for male infertility is varicocele. Remember, I explained the testicles are formed in our abdomen and they are pulled down and they are bringing blood vessels. If these blood vessels are prominent and big, and sometimes males feel it when they feel their scrotum, it's like a bag of worms. If these veins are very prominent, they are working against you. The reason nature pulled testicle from abdomen to scrotal sac so that they could work properly at lower temperature. But now blood vessels are bringing a lot of blood, increasing the local temperature, and your testicles cannot produce quality sperms, leading to male infertility. Remember, one cause for male infertility. Next question, can infections lead to male infertility? Absolutely. Any kind of sexually transmitted disease, like especially epididymoarchitis, this is the infection of your testicle or the infection of the epididymis. Remember, that is the part where the sperms are stored and mature before ejaculation. If you have infection, that will lead to storage problem, maturation problem. And also these are very fine tubes. If you have inflamed, they get scarred, they get blocked, and then the sperm cannot pass through. That's why we always insist to have safe sexual practices. If you had sexually transmitted disease in the past, let us know, because many things can be done. Make sure you practice safe sexual practices. If you, God forbid, you have infection, you must get help quickly so that you are given proper antibiotic and you are treated quickly. Let's start from our first discussion. We start from hypothalamus. Hypothalamus produces a hormone called GnRH, which can lead to decreased production of GnRH decreased production of SH and LH from pituitary gland, and can lead to male infertility. I think it's a good place to discuss role of testosterone in relation to your fertility. Unfortunately, in male literature, there is a lot of chaos and confusion. People do not understand that testosterone has nothing to do with the sperm production. Testosterone leads to some part in maturation and development of your sperms, but the feedback loop back to pituitary gland is through the testosterone. If testosterone level goes up, pituitary will sense that your testicles are producing too much sperms and testosterone. It will shut down the production of SH and LH. But there is a beautiful harmony. If you allow your body sensing system, there is now never a problem. What is happening in you is that testosterone now goes to your pituitary gland and cut down the production of both FSH and LH. Because now your pituitary gland is not producing both the hormones, especially FSH, so your Sertoli cells are not producing sperms. So you are killing your nature and killing yourself is by taking testosterone from outside, you're cutting down sperm production. Yes, you may be buffed up, but you will be infertile. Do not take testosterone replacement if you're planning to have family in near future. Testosterone in male literature is given bigger hype than what the science supports. Somehow there is a cult built around testosterone therapy, and it is done by organized clinics, organized magazines, because if I could get into your head that your testosterone is low, you are their client for the rest of your life. So make sure, talk to your physician and try to understand how this physiology works. Next question was, what are the genetic disorders which can lead to male infertility? Here, there will be either a problem in the Sertoli cell or the conducting small ducts which take the sperm from these cells to the epididymis where it is stored. If you have a problem with the Sertoli cell, the chromosomal disorders, most common is Klinefelter syndrome. Each male cell has two chromosomes, one from mom and one from dad, which is X and Y. If for some reason, either from dad's side or mom's side, if you have a 2X and 1Y, so your chromosomal pattern is XXY, that messes up all your functions. And how do you find those guys? They will be tall, their bones will be long, they will have gynecomastia, very little hair, and they have difficulty with spermatogenesis and infertility. This is a common problem. About 1 to 2% of male have this pattern. And if that happens, you will have difficulty in achieving pregnancy due to chromosomal disorder, which affects the small tiny tubes, tubules which take the sperm from where it's produced to be stored in the epididymis. The most common offender is cystic fibrosis. These ducts get plugged up with the mucus, and then your system is clogged up, and the sperms cannot transfer and cannot be transferred to female genitalia. I hope this chromosomal, especially Klinefelter, is more clear to you than before. Then next comes at the what are the medications which affects male fertility? Most common is testosterone. Second is marijuana. It is a proven fact, and as marijuana is getting approved in all states and people are using it injudiciously, people are really not living to the spirit of this law. It is a common practice we find. Each state requires that you need to register, and then you're given a card, and then you have a marijuana specialist doctor who will give you a prescription, and you will go and you get them from a certified pharmacy. every day I see 60 to 70% of the people, they do have a card so that they have a legal, and they still continue to buy on the street. Stop using marijuana. Second is testosterone. I just now discussed with you in detail. Lot of vitamins, mineral deficiencies have been linked directly with the male infertility and the medications. Now, what are the solutions? What is the treatment if you have male infertility? First of all, we'll go after, is it a hormonal problem with thalamus, pituitary gland? Then we will give you medication to correct your hormonal issues. If there is a problem with the conducting system, you will be able to, your specialized urologist who specialize in male fertility, they will be able to do a lot of procedures and help you. If everything fails, they can take out your sperms and then they could transplant into female genitalia and lead to pregnancy. And these are the things which are very common. It is like IVF, the way we do it in females. This is exactly the same procedure. There we are taking the egg and putting this in somewhere else. Here we're taking a sperm and put it in a female genitalia and leading to fertilization. Then now it is a very common practice to have your sperm stored. We call, in this podcast, what I have tried to accomplish is to give you a overall view regarding, starting from hypothalamus to pituitary gland, the pituitary gland producing two hormones, FSH, LH, then going down to testicle having two cells, then the conducting system of the testicle, then the conditions which affect testicles, both conducting system and structure, then some insight into female genitalia. We have a very intricate system where everything has to click right, and there are millions of chances where it can go wrong. I hope we understand this process more. If you have difficulty in achieving pregnancy and your wife has been, or your sexual partner has been tested, I would say start with your primary care physician. But we are not the physicians who will treat you for any kind of male infertility problem. We will start the initial workup with the history, physical, any imaging study or the hormonal study, and then we'll refer you to urologists who specialize in male infertility so that you could achieve the desired goal of conception and you are able to start your family life. Thank you very much. My name is Dr. Gurmeet Kundlas, and I will see you in next video. Please subscribe to our channel Kundlas MD, like, share, and above all, please do comment, because that is a very positive force for us. We feel excited with your involvement, and that gives us insight, and so that we could act and start